Of all the struggles of parenthood, one not only tends to throw parents for a loop, but frankly, most doctors as well, not to mention educators, friends, and relatives.
In society, there are rough estimates that there may be anywhere from 2.5 to 8% of the pediatric population has gender variance of some sort.
Dr. Ghosh is a developmental behavioral pediatrician at the Montreal Children's Hospital. He is the only doctor in Quebec who specializes in pediatric gender identity issues, and he heads the only gender variant clinic in Quebec.
Currently, I have probably somewhere about 100 or a little more than 100 families that I'm following, so I'm getting new referrals all the time.
Most agree that medical treatment is not a solution in addressing gender identities. Rather, they advocate for education in order to reduce social prejudice against gender variant and transgendered people.
Mostly it's a question of ignorance and people just needing education, but I also think it shouldn't be up to trans people to educate non-trans people. And I think go read a book. Go watch videos on YouTube.
Now they call it gender identity disorder, which a lot of people don't appreciate. Especially if someone has a child or someone is a child going through that, the word disorder is, it's labeling them that there's something wrong. And this is a sickness or an illness that needs to be cured.
Really is not a disease, right? There's no there's no medicine to treat it that cures it, and nor do we really want that to be the case, because it's a personality expression, it's a way of being. And there are many, many different ways of being, and we don't want everybody to be exactly the same.
Although gender identity may not get much public attention today, it is a viable issue affecting many families.
We're not on people's radar, and that's slowly starting to change, which is why I think more and more parents are going to Dr. Ghosh.
Really, the treatment, from my perspective and from the perspective of our gender variance program, is not to treat the patient so much as to treat the issue.
Dr. Ghosh is building a multidisciplinary team to offer wider support and services to gender variant and transgender youth in Quebec.
It's a challenge. Yeah, it's a big challenge, constantly juggling time. It's you're just looking for the moments when you can fit in as much as you can. So it's not easy.
For Concordia News, this is Paulina Ignacak.